If you're using reproductive medicine to have a child and you feel like sex is just something that's been relegated to your to-do list, if you're worried about your sperm health, or if you don't have any libido left, this episode is for you. You are not broken and you're not alone. These are very common difficulties. Whether you're a heterosexual couple trying to get pregnant at home, a queer couple, or a single parent to be, fertility treatment can really drain your energy and your desire. In this episode, you're going to learn about what actually improves sperm health, what is going to help you rekindle your desire, how to reconnect emotionally, and so much more. My guest, Dr. Rena Malik, is a board-certified urologist and sexual health expert, and she sees these issues every day. This will not be theory. This will be practical and evidence-based. But before we dive in, I wanted to mention that I've developed a resource to accompany this episode. It's called the Fertility Intimacy Toolkit, and you can get it for free by emailing me at lisa@familybuilding.net and just write the word toolkit, and I will send it to you free of charge. You will also get updates on resources that we're offering on our platform, which you can unsubscribe to anytime. So take a look in the show notes or just email me at lisa@familybuilding.net. I hope you enjoy the episode, and I hope you enjoy the toolkit. From our Building Your Family community, this is the Building Your Family podcast. I'm your host, Lisa Schumann, author, researcher, and reproductive medicine therapist. Welcome to a new episode of the Building Your Family podcast. Today, we really hit the jackpot because you're going to learn so many wonderful things from an expert who's also a very kind person, thoughtful person, and social media influencer. But you are going to get evidence-based information like we like to talk about here. It's very hard to understand what to believe and what not to believe on social media. And so today you're going to learn such important things. And we're going to be talking about something that affects almost everyone. And very often people get depressed and they experience low libido. And they also don't know what to do and what not to do when it comes to positions or semen health or anything else that we see on the internet. So today we need to clear all these things up, and we're going to help you both talking to Dr. Malik and also giving you an opportunity to read about this in our ebook. Welcome. Thank you so much for coming, Dr. Malik. I really appreciate you coming and telling us all of these wonderful things that we really need to know and will change so much for us.
Well, thank you so much for having me.
Can we start with the idea that many people experience and don't talk about very much, but that there's a lot of pressure to perform when people first start trying to get pregnant at home, or even when they're starting with Clomid, or they first see their gynecologist and they're giving them these instructions to have sex every day or maybe to wait. How can we know what to do and what not to do when we're trying to get pregnant on our own?
Trying to get pregnant is it's such a very special time. It can be really wonderful, right? You're connecting with your partner, you're trying to have a baby, but when you're struggling or it becomes more of a, ritualistic thing because you need to try to have sex every day or every other day around time of ovulation, it can start adding sort of pressures. And obviously the pressures of maybe not conceiving right away when you want to and months going by, that adds an additional layer of stress. And all these things can make sex a lot less fun, right? It used to be something that you did for fun, for pleasure, and now you're doing it with a purpose in mind. And so it can lead to these issues where, for example, for men, a lot of performance anxiety, right? Because they know they got to go. It's reliant on them to have an erection when you need it during that time of ovulation. And if they don't get one, that then leads down to sort of a very slippery slope because oftentimes men don't often explain or express their dissatisfaction, but they definitely think about it. And they're worried about now, is something wrong with me? Am I not able to get an erection? What's going on? But it's really just the stress and the pressure of performing. And for women also, it's important to make sure you have time for arousal and actually, enjoy the process of sex. It's still a pleasurable experience. It should never hurt. You should be able to enjoy the experience and have pleasure. And so I think that the biggest thing to remember is yes, you may be needing to sort of schedule in sex, but that doesn't need to be something that's a negative. In fact, it can be something that you look forward to. So if you schedule it in on the calendar, you can say, hey, look, we know we're going to be having sex during this time. Let's build up. Let's try to cultivate an environment of desire. Maybe we do something fun together as a couple before you go get massages or not obviously every time you can't do that, but try to do something that sort of sets the stage so you could feel desired, both of you. And it can be as simple as a flirty text. It can be a nice caress on the back in the morning, just saying like, can't wait to see you later. It can be very simple. It can be even incorporating things like role play, novelty, like trying to have sex in a different room or in a different position to sort of just change things up, right? Not make it so stressful and serious. Sex is still supposed to be fun. And realizing that, if something happens, you're human, right? Like you are not a robot. Things will, not work this perfectly every single time, especially when you're trying to do it in sort of a more urgent or time sensitive manner. But again, I think it's important to remember sex is about play, it's about connection, it's about intimacy. So trying to cultivate that even when you're trying to conceive, like making it a priority. And it doesn't need to be a big thought out thing. It just means that we need to make it so that you feel like this is a fun, pleasurable experience and not just rushing to get it done.
And how do people do that when they're feeling, when they're feeling depressed or feeling maybe in the beginning, well, they're trying and it's exciting and fun. And now they're on the schedule and they feel depressed. It's not working. And so very often men will say, well, I just can't have an erection. It's just too difficult. It's too much pressure for me. I can't deal with this. Do they try to take some medication like Viagra, or do you think that they should do other things to try to stimulate themselves? What are your thoughts about that?
So I think one is, I think also like it's cultivating an environment of desire for them, right? Like alleviating the pressure and especially how you react if the partner can't get an erection, right? Realizing that this is not about you, they are struggling. And so making sure that you react in a non judgmental way. Obviously, the stressor needs to be dealt with, right? So meaning like you need to figure out ways to de-stress, and that's easier said than done, right? I can tell you to do that, I can tell you to like go meditate or whatever works for you, but it's not that simple. But I think it's important, especially during this time of life. Like you hear about it all the time, people having their like surprise pregnancy when they're like not even thinking about it, right? Because they're just finally relaxing, and it plays a huge role in fertility. So I think, whatever you can do to reduce stress. Now if you're clinically depressed, meaning you've felt down or out for 6 weeks or more and it's been causing significant distress, absolutely see a psychiatrist because you need to get evaluated for that. In terms of specifically the erectile function thing, right? So when you talk about psychogenic erectile dysfunction, one, you want to make sure that you don't have other reasons for erectile dysfunction, right? You could have other underlying conditions like high blood pressure, heart disease, diabetes that can affect erectile function. So it may be more than just stress. And that's why it's important to get evaluated, because when you have erectile dysfunction, if you have an organic cause, within 7 years, 15% of those guys will have heart attack, because that's the sort of
Wow.
the cause of what is causing the erectile dysfunction is unhealthy arteries and unhealthy vessels. And so we need to address the underlying issues. So please don't ignore it. Don't just say it's stress. Get evaluated. And then if you do determine that it's obviously a medical issue, that's one thing you want to address the underlying causes. But if it is psychogenic, either way, medication can be very, very helpful. Now, most people think of Viagra or Cialis, you take it when you want to have sex an hour before. And that works really well for some people. But a lot of times, especially in guys who are dealing with other stressors, it can just add another stressor, right? Like you're taking a pill. Oh, is it going to work? I don't know. I'm stressed about it. So sometimes what I'll do in these guys, especially when there's a large psychological component, is I will do a low dose, 5 milligrams of tadalafil every single day. That way it's always on board. It's in the background. You don't need to think about it.
Hmm.
And then hopefully that's enough to allow you to get an erection when you need it. Now, if you still need an additional boost off label, you can take an additional, little bit of tadalafil or sildenafil, which is Viagra or Cialis, on top of that on the day you want to have sex. But I find that that really helps because it's just working in the background. It helps you get your confidence back. Now, it does, you do have to work through, like I said, it's not sexy, but you got to work through the things that are stressing you out. And so it may mean that you got to figure out like you may need to take a step back and say, like, look, we're going to just be intimate. We're just going to love each other. We're going to hold each other. We're going to caress each other, but we're not going to focus on penetration. And that way you can allow yourself to have an erection because you're not thinking about it, right? If it is psychogenic, now you're not thinking about it. And then once you feel comfortable, you can start touching genitals, but not like on another day altogether. You can start touching genitals, but again, no penetration. Penetration's off the table. See how you do. And then come back again once you feel comfortable with that and finally go to penetration. But sort of working your way up to sort of feeling more comfortable with your partner and not allowing that stressor to come into play because you're not focused on penetration. You're focused on being together. And so I think that's helpful. And then if you're really struggling, then getting a sex therapist can be extremely helpful in helping you work through these issues.
Yes, that's great. With a lot of the patients that I see, I discuss these sorts of things with them, but I had no idea that people could do this in conjunction with taking a low dose of medicine because as you pointed out, the confidence is so important there, right? If people are thinking it's almost like mind over matter in some way, right? That people are going to feel more confident and therefore they probably will be able to have a better chance of having an erection.
It really does make a difference, I think, for a lot of people. And then the other thing is if you're getting good morning erections, that's a good sign that things are working well. So you don't need to, you don't need to catastrophize, but that's a good self indicator like, hey, I get good morning erections every day. Nothing's wrong with me. I just need to deal with this stressor. And this is completely normal. Going through stress, going through, infertility and struggling with that, that's a stressor, right? And it's normal for your
Yes.
body to respond. So I think just feeling like you're not alone, this happens to a lot of guys and then working through it with sort of like the things we've talked about can be helpful.
And just to go back to what you said before about this heart health, I'm sure a lot of people are wondering, well, is that going to be me? That's a little bit scary. So if men are having a morning erection, is that an indicator that their heart is probably okay? Or how do we think about that?
It's definitely a good sign. It means that when there's no brain, right? You're just totally like sleeping, that your blood flow is intact, your hormones are intact, your nerves are working the way they need to. So all those things are functioning in the normal way. Now, the one thing I did forget to mention is that if you're on an antidepressant, that can absolutely affect
Yes.
your desire. And so that can, if you're not feeling desire, you also will have trouble getting an erection. And so if that's the case, talk to your psychiatrist or your primary care doctor to either lower the dose or
Mhm.
switch the antidepressant to see if that might help.
Oh, that's great. That's great. And then what about for the single parents to be and the queer couples who say, well, obviously I'm not going to get pregnant by accident, but it's really affecting our sex life or it's really affecting my libido. And this is so hard because then I feel even more stressed in my life if I can't feel like I'm having a normal sex life or I feel like I can't have that release with my partner and now all of a sudden it's affecting our intimacy and I just don't feel the same anymore. Do you recommend similar things for that group?
I do. And I think this applies for all ages, right? Like, not just when you're trying to conceive, this could be later in life, this could be at any point in time. Is if you're struggling, like, get evaluated. Because even for women, right, if you have low desire, low libido, we don't have the abundance of data in terms of heart health. But if your clitoris isn't getting good blood flow, that's the same thing that happens to the penis when they get erectile dysfunction. So if you're having trouble getting aroused, that might be a good sign that you should see your doctor to see if you have any underlying conditions that might be, playing a role. So I think one is always get evaluated to check your blood pressure, your cholesterol, screen for diabetes, make sure that you are in good shape in those regards, that your blood vessels are healthy. And then if you're still struggling, like stress is, I always say the most important part of the most important sexual organ is not your genitals, it's actually your brain, right? If you are not
Mm.
in the moment with your partner because you're thinking, you're ruminating, you're stressed either about your performance or whatever else is going on in your life, you can't be present and you can't get an erection or you can't feel aroused because you're just not there. And so mindfulness meditation has been studied in women specifically. and has been shown to significantly improve multiple domains of female sexual function, including arousal and desire.
Wow.
Expect the same thing would happen for men. And they did 20 minutes of mindfulness meditation daily and they saw significant improvement. And many people in this study, which I think was like 12 weeks long, they continued doing meditation afterwards. And when the research team reached out to them a year later, many of them continued doing mindfulness meditation because they saw so much value in it in terms of how it improved their overall life. And it's just about being present, being mindful, being in the moment, not thinking about other things, allowing yourself to enjoy touch, enjoy pleasure, and really just being in the moment. And guys, this is not easy. It's easy for me to say, but it's hard work. And sex, it's okay if sex is work because it's worth working for. You want to have good sex. You don't want to give up because you're frustrated or because you're stressed. You want to work at it and you want to talk about it and figure out what's going on and try to work towards like, how can you reduce stress? What's the issue? How can I fix it? And realize that it's okay if things don't work perfectly. But the more important thing is that you're going to work to get them better.
Well, that's so helpful because I think that's the other piece here that so many people feel like, well, I'm depressed and so I have low libido, or I'm trying to get pregnant at home and I can't perform. And they feel like, is this going to last forever? Am I always going to have this issue?
Yeah, and I think that the reality is that likely not. Once the stressor is relieved, oftentimes people notice things are better. Think about when you go on vacation, right? You go on vacation, you probably have amazing sex because like nothing's on your mind, you're enjoying life and you're like whatever, like I have no stressors. It's the same thing. When the stressors go away, things revert back to the way they used to be in a good way, right? And
Hmm.
so life is evolving. Things are going to change. There's going to be times where you're going to have more desire, your partner may have less, or vice versa. And realizing everything is, it's just fluctuating throughout life based on what's going on. Now it's having a baby. In the future, it might be taking care of that baby. And in the future, it might be your aging parents. There may be other issues in your life that are going to cause you stress. But that's why it's valuable to sort of figure out, like, hey, if stress really affects your sex life, then we've got to figure out how to separate those things out so that you can sort of be present in the moment with sex rather than thinking about your stressors.
Yes, yes. So helpful. So helpful. I think you would agree that this episode is full of useful information. And if you'd like more, you can download our free resource, the Fertility Intimacy Toolkit, by emailing me at lisa@familybuilding.net and just write in the word toolkit, and I will send it to you for free. You will also receive updates from us, which you can unsubscribe to at any time. Now back to the episode. You're talking about men and women also have, as you mentioned before, some time that they need to kind of warm up to their sexuality or their feelings of intimacy before they are actually getting close to that climax feeling. So, does that also change for men and women? Do they need additional stimulation or maybe sex toys or things like that that may help along the way?
So it's individual for everyone. I will say gendered, we know there's differences. Men tend to be a little quicker when it comes to arousal, but that doesn't mean that it's like one and done and they're ready to go. But, they do tend to be quicker. Women take longer. So it can take up to 30 minutes for women to be fully aroused. And what that means is that they are well lubricated, that their vagina widens and lengthens to prepare for intercourse. And so it's actually really important to ensure that your female partner is ready for intimacy. Otherwise, it would be painful, uncomfortable, or just not pleasurable, which nobody really wants, right? So I think it's so important to focus on doing things foreplay, right? Like in some way, shape, or form to make yourself feel ready for intercourse. In terms of adding vibrators or stimulation, that can be very helpful to, especially like when you're maybe trying to add novelty, right? So you're trying to add novelty and maybe you're struggling to climax because you're stressed. So adding a vibrator, I often tell couples, like if you want to get like a vibrating ring for a man, that means he gets stimulation and the partner gets stimulation. And so it's like kind of a win-win. Those kind of toys are really fun because then you both sort of get something new and something fun to
Yeah.
play with. go to a store and see what you like and try different things, or just go on Amazon. I mean, you can find all sorts of different types of stimulations, and it doesn't have to be like a sex toy. You could get a feather and just try to like rub each other with a feather and see that stimulation, what that feels like, and just experiment, obviously with safe things. Don't put anything in orifices that don't have flared bases. We don't want to get things lost. But in general, like there's lots of fun things you can play with temperature, like you can use ice cubes, you can use
Mm.
like a warm heating pad, like just different things to sort of like just change the experience up a little bit.
Those are all great tips. That's wonderful. That's so helpful. As we're talking about all of these things that we need to think about, and certainly with lubrication with women, I know that there are some lubricants that are more helpful than others, or some are actually detrimental to sperm health. Is that right?
Yeah, so you want to make sure like some lubricants have spermicide in them, which is obviously not what you want to use.
Yes.
And then obviously, like there are actually some lubricants that if you look on them, like Good Clean Love makes one, which is like fertility safe or good for fertility. And so I would just generally recommend, like if you're struggling with infertility, invest in one that is sort of marketed for being safe, optimized. Basically, the ones that are the pH that matches the vaginal pH, so it's not changing the vaginal microbiome, and that sort of thing can be helpful.
And how does somebody know that? Are they water based or oil based? Are they different in some way?
So yeah, there's three different types of lubricants: water-based, and in the water-based, you can also see aloe-based. Sometimes you'll get an aloe-based. Those are typically have very few ingredients, are pretty well tolerated. And so those are kind of the ones you're going for. And those are what you'll also find. Some of them will be more, they come in different pHs, right? So they should say like similar to the vaginal pH, or,
Oh,
and being careful because there are some that are made for anal lubrication, and that's a different pH. It's a higher pH.
oh,
So you want to make sure you get ones that are similar to the vaginal pH. They do need to be reapplied. Water based lubricants evaporate. So if you're going to have sex and it's going to be longer than a minute, you're going to probably need to reapply for comfort. There's then oil based and there's silicone based lubricants. Now, to my knowledge, you can still use them when trying to have intercourse, but some people are more sensitive and will are a little bit more predisposed to yeast infections with oil based or silicone based lubricants, but not always. They're just a little bit more slippier. They last a little bit longer. But again, the key thing is make sure there's no spermicide in any of the lubricant, because some of them will just sneak it in, and they'll say
wow.
they, I mean, they'll usually say it, but it might not be very big on the packaging. So just make sure that there's no spermicide in the lubricant.
You have to be a real detective. Make sure you get the right.
Yeah.
And if you're just using it, if let's say you're two men in a couple, it could kill your sperm also. And so no matter who you are, you really have to be mindful of that. Yeah.
Absolutely. And for men having sex with men, I would absolutely get an anal lubricant because they have a pH that's similar to the anus, and that's usually just a little bit more
Oh,
physiologic. Yeah.
would that affect their sperm as well?
I don't think, I mean, because once the sperm is out, it shouldn't really affect anything, but I would just say for safety and comfort for them, that's probably better.
I see. Since we're talking about sperm, what about sperm? We've interviewed a lot of people who've needed to use donor sperm, or they've had problems with their sperm health, and how difficult that is for men. And, very often they feel humiliated and they get very upset about it. And they don't know because sometimes the doctors will prescribe testosterone or not tell them to get in a hot bath. So I'd love for you, Dr. Malik, to set the story straight and tell our audience what we really need to know about sperm health.
Sperm health is so important, and I wish we talked about it more. It is like a biomarker of health. And so, a lot of times, when you have poor sperm, it's actually a sign that there may be other sort of things that are also negative, because the things that affect sperm health are also inflammatory and poor health and things like that. Poor health habits can also affect sperm health. But let's talk about what I think the first thing is. I'm sure your audience knows this already, but get a semen analysis as soon as you're trying to conceive. I think a lot of times people delay this for some reason. I don't know why, but all the men I've seen, usually their partner's already getting evaluated when their semen analysis would have taken just a couple minutes and they would have had a result very quickly. So don't delay. It's super easy. If you don't want to go into a clinic, there are at-home semen analyses now, which are very convenient. They're, I think, around $300, but you can, that way you can just deliver your specimen in the comfort of your own home and then mail it out. So there are options like
Mm,
that available now. So, it is an option if you're very nervous about doing this in the lab or something like that. So then things that can affect your sperm health. So first and foremost, you mentioned testosterone. So if you take testosterone, it will reduce your fertility. After about 18 months on testosterone, your semen numbers will go down below an acceptable concentration for fertility, meaning that it would be
mm,
nearly impossible for you to get someone pregnant with that level. It is not a contraceptive, right? So if you take it, there are still sperm in your semen, but there's not as many. There's much less than would be needed to get a partner pregnant. So really important to know that. And that 18 month is what we know, but even within months, sometimes it can happen sooner. Sometimes you
mm.
can still get someone pregnant. So it's important though to realize if you're trying to have a baby, you should not be on testosterone. The good news is if you're on testosterone, it doesn't mean that you're, oh my God, I'm going to be feeling horrible and my testosterone is going to be zero. We can bridge you with off-label options similar to what your partner might be taking, like Clomid or HCG. Those things can also help bridge you during that gap if you see a sexual medicine expert to sort of work with you through that.
Oh,
Or a fertility expert is probably
wow.
even better because you'll get 2 for 1, right? So that's really, really important. And so if you're on testosterone, you might want to have kids, please stop and talk to your doctor about getting off of that and onto some off-label options that might boost your fertility as well. The temperature thing you mentioned. So when you have any increase in temperature, that can be even a fever, right? You can sometimes drop your semen analysis down to 0. So we'll have
Wow.
sometimes guys come in, they'll have had a fever a week ago. And remember, the life cycle of the sperm is like 72 days. So even during that whole time, if you had a fever and it killed all your sperm, it might be a while till you see new sperm. And so generally we'll say if you have a really low count, you want to repeat that semen analysis within, 3 months or so to see if anything's changed. It doesn't mean that you did something wrong. It just means that your body temperature got really, really high and it turned off its ability to make healthy sperm. Similarly, if you are exposed to a lot of wet heat, so like steam rooms, saunas, hot tubs, those things can affect fertility as well. So we generally recommend not doing that. Now, these are not evidence based, but I tell guys, put your cell phone in your back pocket. Don't put your laptop on your lap, right? These are all things that can increase temperature. In terms of boxers or briefs, there's really no great evidence, but I would say if you're comfortable in boxers, wear boxers for that period of time. There might be a slight, tiny benefit, but probably not a huge one. That's about temperature. Then there's sort of the things in general lifestyle, right? We know that guys who have a lower body mass index, we know that guys who eat a more Mediterranean diet, we know that guys who exercise more overall have better fertility. So if you're not doing those things, incorporate them.
I'm just so curious about that. Why is it that if you're maybe overweight, that would affect your sperm health?
Yeah, so the sperm are housed in the testicles, and the testicles are a very, very sort of specific environment, and they're very sort of sensitive. So when you do things that can increase oxidative stress in your body, like eat fried foods or you are sedentary, you're basically increasing oxidative stress that then affects the health of the sperm. And so all these things, and they can affect, insulin resistance and sort of overall metabolic health. All of these things can have oxidative effects on oxidative stress in the actual testicle itself. Also, these things have effects on hormonal health, right? So when you are having poor metabolic health, it can actually shut down the production of or decrease the production of signals to your testicles to make more testosterone and to make more sperm. And so we want to essentially optimize your hormonal health. We want to optimize your testicular health, so where they're living. And those things are going to make sure that you have all the necessary parts to create healthy sperm.
Is that like a certain BMI, or is it something that we have to people have to look at and say individually if their doctor's saying they're
I mean, look, BMI, generally we want people in a healthy BMI. There's lots of people with above like normal BMIs that have healthy children. So I would say, and have good sperm parameters. But again, if your semen health is not optimal, then you got to do everything that you can. And that's, again, a very
right?
simple test. Get a semen analysis to see where you're at. And then, even if everything is great, I still think these are important things for your overall health, right? Because they're going to improve testosterone, they're going to improve erectile function, they're going to, make you feel better overall as like a whole well-being. So I think they're good tips in general. And then the other thing I said, stress. So stress is super important, not only for the performance aspect of things, but also because when your cortisol rises, which is what happens when you have, like, of course, it rises throughout the day and periodically. Acute stress is okay. Acute stress is actually good. When you have chronic stress, meaning it's there for days and days and days, that actually has a chronic level of increase in cortisol. And it tells your brain, hey, it's like the opposite of testosterone. When your cortisol is up, your body's not making testosterone, which means it's not making sperm. So we got to actually work to reduce that stress. That's again, I think part of the reason why when people reduce their stressors, they tend to get pregnant more easily.
It's amazing.
Yeah. And then lastly, like our environment, right? And I think a lot of people get worked up about this a lot. We definitely know endocrine disrupting chemicals can affect sperm health. But what I don't want you to do is start stressing about those endocrine disrupting chemicals so much that now your stress is elevated. So I tell you all
Right.
this with like a grain of salt.
Yes.
So, things you want to avoid is drinking out of plastic or eating out of plastic. So, if you can avoid it, especially heating things up in plastic, or like if you've got a water bottle sitting outside in the heat, just don't drink that one, right? So, that's going to be helpful in avoiding microplastics. You generally want to try to just limit, if you have food, heat it up in glass containers, buy BPA free bottles. That sort of stuff is easy to do. It's not like upend your life. I think otherwise people start like, what I learned actually, people start, oh, maybe I should move my cosmetics into glass bottles. But actually, the cosmetics are made in such a way, or like personal care products are made to be in that product. So we don't know how shelf stable they are when they're put into another sort of container. So I don't want people to go crazy. I think it's just important to try your best to minimize your exposure to a lot of plastic and try and like, just live a healthy lifestyle as best you can. There's not much that I would say like you and like if you can try to like dust regularly because there's like microplastics in the dust. Try to wear more cotton fabrics or hemp. These are sort of little things that you can do. But mostly I would say just try your best to like if you think it might not be good for you, don't do it. Like it's pretty common sense, right? Like, oh, if this bottle almost looks warped because it's being in the heat, like maybe don't drink out of that one, you know?
Right. Well, I always wonder about that because any bottle that you get, even in a gas station, probably was on a hot truck at some point, right? And
That's
so,
true.
the damage might be done. And I'm always wondering, particularly since now we see microplastics in follicular fluid.
We see that in the sperm too. We've seen them
Hmm.
in sperm. So there's a study of 8 guys
Wow.
where they found microplastics in the actual testicles. So
Oh my
we are
goodness.
seeing them, but we're consuming a lot of microplastics regularly. But I think the big one is in food and drink. And so I think if you can, again, I avoid drinking out of plastic as much as possible. So take your own water bottle. If you want to get a filter on your water, that's great. Drink out of filtered water in your glass bottle. That's going to be the best. But if you have to occasionally have a bottle of water from a plastic bottle because you're at a conference and you're thirsty, like just have it. Don't worry about it
Right.
too much. Is my point. Don't
Hmm.
be like, oh my god, I'm going to die of thirst because I can't have this plastic water bottle.
Right. Right. You
Yeah,
have to hydrate also.
yeah. So yeah, those are the big things. And then
Diet and hydration. What about that for men? Is that the same?
the data would suggest that the Mediterranean diet is the most beneficial in terms of hormonal health and sperm health. So that means whole foods, whole grains, a little bit of fish or meat, lots of vegetables, and some healthy fats like avocados, olive oil, nuts, that sort of stuff. So I think that the important takeaway is like try to minimize processed foods as much as possible. Make sure you have good, healthy fats. I think the one thing is if you get too low on fat, that can actually be detrimental to sperm health. So, and same thing with exercise, too much endurance exercise, like to extremes, like if you're a marathon runner, things like that, that can also negatively impact sperm health. So, you want to make sure you keep a little bit of healthy fat in your diet, and you want to make sure your exercise is moderate and not so intense.
So, what would moderate mean for the people out there if they're going to the gym 3 times a week or 5 times a week?
So I think that's fine. It's mostly like prolonged endurance sports. So like you're
I see.
doing like running or swimming or biking for hours at a time. That's going to be sort of a stressor on your body. And some stress is good. Too much is not a good thing.
So the idea is everything, all of these things in moderation.
Yeah. Yeah. And honestly, most people are not going to get to the point of very intense. It's like the ultra marathoners, the regular marathoners, the like really long bike riders. Those people, they know who they are. The regular
Yes,
person who's going to the gym 3 times a week or 5 times a week for 30 minutes, please keep doing that. That's very important.
because that just keeps your body healthy and your blood flow and all of that.
Keeps good blood flow so that your body can keep doing all the important things, getting good erections, getting blood flow to your brain, getting blood flow to your heart, all the important organs.
That's great. That's so helpful. As people are starting to think about this more and more and thinking about their health and thinking about their sperm health and how to optimize it. You said before, and I think it's helpful for people just to understand this, that your sperm is going to regenerate. It's so different than eggs in that way. And so people do have this opportunity to change their lifestyle.
Absolutely, and it's great because you could track it, right? You can get a semen analysis, you can make a lifestyle change for 3 months, and then you can check another semen analysis to see if things have improved. And so it is sort of a great thing that men have this ability and they can change it to some degree. Obviously, there's some genetic abnormalities aside and things where they don't make sperm, but for the majority of people, you can. And then if you are in that situation where you're struggling, we have lots of options in terms of getting sperm from you in either through TTC or like through sort of fertility extractions, or we can either take it from the epididymis or the testicle. So there are other options as well if you have some sperm but not enough.
That's great to know. That's really helpful. And then what about this idea of alcohol and marijuana? So a lot of people are
Mm.
changing their life to start to minimize or eliminate completely alcohol consumption, but there's this belief out there that, well, marijuana is so much better for me, and then they just smoke as much as they like. And so people probably are not thinking, how is that going to affect my sperm?
So toxins in general, right? Alcohol and marijuana are toxins to some degree. They're not good for you. Let's talk about marijuana because we see it a lot, especially since marijuana has been legalized in multiple states in the United States. Marijuana, if you're a chronic user, it will suppress your fertility. And it will suppress your libido to some degree if you're using it chronically. So I don't love marijuana being used sort of, especially when you're trying to conceive. If you're not trying to conceive, I guess here or there, occasional use, we don't know if there's any detriment to that yet. But in terms of when you're trying to conceive, I would say eliminate marijuana if you can, eliminate alcohol if you can. Just try to avoid anything that could harm your fertility because it really can have a tremendous impact. And when you stop those things, like you said earlier, with men, you guys have time to regenerate and make new sperm, and you will rebound. So that's the good news.
And it's so important for people to know this. So I really appreciate this, Dr. Malik, because so many people dismiss it thinking, well, that's a natural version of something to do recreationally, but it's actually toxic to our bodies.
Absolutely. And you know what? We just don't know enough in terms of what like recreational use can do over time, right? So just because it comes from a plant doesn't mean it's okay to do all the time. A lot of things that we use day to day come from natural sources, like Botox, for example, but you don't want to put a lot of that anywhere because you'll paralyze yourself. So, you know,
Yes.
got to be cautious.
Yes, yes. And what about other supplements and things like that? Because we know that there's more and more use of supplements for all sorts of things, including libido. And people think, well, because it's natural, it should be better but there's no regulation, right? And we don't know what we're taking or not taking. And so what would your recommendation be for your patients?
So in the men's health space, they've actually done pretty rigorous studies on supplements for fertility. And so
Oh.
there was, one pretty remarkable study. I can't remember the name of it right now, but essentially it didn't find any benefit to taking supplementation for male fertility. Now, when I trained, we still offered a couple things to men and we would say, try these two things. There's not an abundance of data, but there's some. and get them as individual supplements because it's cheaper than buying the men's health, like, fertility supplements. So we say L-carnitine is coenzyme Q10 that we would recommend. But for the most part, I would say that take a multivitamin. That's not a bad thing, and just optimize your overall health. There's no yet clear evidence on any supplements that are like perfect, great, wonderful for for sperm health.
Do those supplements that you're referring to need to be monitored? Do people need to get their blood levels taken when they take those supplements?
I don't think so. Not with L-carnitine. That's basically an amino acid block building block. So that one
Mm,
is not really something that you would measure. That's why it's important to see a male fertility specialist because it's really important for someone to be helping, guiding you through all this rather than sort of trying to figure it out yourself. The study, just if anyone wants to look it up, was called the MOXIE trial, MOXI. So, generally what it found was that there was antioxidant supplements didn't significantly improve pregnancy or live birth rates. But again, there may be, like I said, there's some sort of data like on taking a multivitamin, which would include zinc, selenium, and folic acid, may be beneficial. And then, like I said, in training, we used to do L-carnitine and coenzyme Q10, which may be beneficial, but there's not an abundance of evidence.
but those things, there's no downside to, right? So it's not like if someone takes a CoQ10 or multivitamin, that's necessarily going to be harmful in any way. Those are just generally healthy things.
Yeah.
Yes, absolutely. And I think everybody out there can see how much we need to know. It's so important to get the right information. I really appreciate everything that you're sharing with us, Dr. Malik. Are there any things that we're missing? Any things that people should be thinking about as they're starting their family building journey?
Just to remember that, like, this is supposed, like, what sex is supposed to be for, right? It's supposed to be a time to connect. It's supposed to be a time to enjoy each other and to try to really focus on building that in. Like you can sort of map out when your fertility window is going to be. So try to like, don't be so averse to scheduling it in. Like think about when we were kids and we would go on dates and you would be excited. You'd be like, oh, I'm so excited to see my partner. When you're a little older, you're like, oh, we might have sex, right? So there was some
Right,
anticipation building. So if you make it like that, where it's like something you look forward to, you enjoy, you connect, like that's the like let's not take the fun out of sex, right? Let's enjoy it. Let's make sure it's some place for us to connect and prioritize that and realize like if you're struggling with infertility, it's not your fault, right? Like but
right.
you could still take this time to just stay together and build your relationship and be strong and be together because it's so important. Like you love each other. That's what you're why you're trying to have a baby together, right? So build that, enjoy sex, make it a routine to just have fun with it and keep doing that.
That's wonderful advice. I really appreciate that. And it really helps us normalize this experience so that people don't have to feel embarrassed if they feel like their libido is not where it used to be, or if they're not feeling like it's easy for them to have sex or get aroused. So I really appreciate that. And I appreciate all this wonderful advice, Dr. Malik. Thank you so much for coming today.
You're so welcome. Thank you for having me.
So, where can people find you, Dr. Malik? I know you have a podcast and you're on social media a lot.
Absolutely. So you can find me on YouTube or on the podcast. Rena Malik MD is my channel and my podcast name. You can make an appointment with me at www.renamalikmd.com/appointments. I am not a fertility specialist. So if you need a fertility specialist, please seek one in your area. But I'm happy to help with sexual health or any other concerns you might be having. And again, thank you so much.
Oh, it's been wonderful, really wonderful. And for everybody out there, please tune in and take a look at all of her videos. There's so much wonderful information there, and it's shared with such compassion that I really feel amazed by every time I watch her videos. So you'll have to see them for yourself. And thank you, everyone out there, for coming today. This is such an important topic and not spoken about very often. And if you felt that this was helpful to you, please press subscribe because that's how we keep going. And that's how we give you the best information possible, not just for your health, but for your family building. And definitely take a look in the notes. You'll get Rena Malik's information and also our ebooks. So come back again next week for more information on the Building Your Family podcast. Thanks again for joining. Thank you for joining me today. I hope this was helpful to you. And if you'd like more personalized support, more information, and more education, you can find it in the show notes under the Building Your Family community. We'd love to see you inside. And if you were interested in today's topic, you will really like this video.